Welcome to the Finding Mental Health Care in Washington, Where to Start class. A team of Seattle Children case managers have put a series of videos together to educate caregivers on how to navigate mental health resources in the community and in the different levels of care. Please note this class will be discussing how to access resources in the community and not focus on the services at Seattle Children's Hospital. This final video in the series focuses on what to do in a crisis. Let's begin by defining what a crisis is. This is when your child is either at risk for hurting themselves or others. Some examples may be physical harming themselves or another person, or not taking care of themselves. If you worry that your child cannot make a plan to be safe, it may be appropriate to bring them to an emergency department. If you or your child are in a crisis situation, here are some things you can do in the moment. If you have created a safety plan for crisis situations with a provider previously, follow that. If you do not have a safety plan, here are some skills to use. Keep your body and voice calm. Make your surroundings as safe as possible. If you can remove things your child may harm themselves with, have only one person do the talking. Use short words and clear phrases. Give space while providing appropriate supervision. Your priority is safety. Problem solving or discussing consequences may prolong this crisis. If you find that you still need support and the crisis is not de-escalating, call 988 to talk with a trained crisis responder who will walk you through next steps. Each county in Washington has its own 24/7 crisis line available to youth and adults. Some counties have additional crisis services available, including mobile response teams specifically for youth. Call 911 only if emergent response is necessary. Emergent means that the situation requires active medical rescue, immediate transport to emergency room, active criminal behavior, or violence. If your child has an outpatient therapist, reach out to them as soon as possible to see the possibility of scheduling an urgent visit with the child's primary care provider and/or therapist. It can feel very overwhelming when calling for help during a crisis. When connected, you can ask for in the moment support, help for yourself, available resources, and guidance on when to go to the emergency room. If you need to go to the emergency room and cannot safely transport your child, call 911 and state that your child needs urgent mental health support. Be specific about the behaviors that are occurring and sharing if your child has intellectual or processing disorder. An ambulance will then be sent to your location to help aid in getting your child to the hospital. It is important to note that during transport, your child will be placed on a gurney and put in 4-point restraints. 4-point restraints consist of straps on their wrists and ankles that secures them onto the gurney to ensure safe transportation to the hospital. You may have to drive separately if there is more than one caregiver. Please see the handout below this video on getting help in a mental health crisis for more information. Thank you for watching, and please take our short survey to share your feedback on these videos.